Hi, everyone. Welcome to the Dish on Aging Tip of the Day. My name is Dr. Maureen Sweeney. I am a clinical psychologist and I practice psychology in Bensalem, Pennsylvania. Today is Thursday, September 16th, 2021. Today, my tip of today is in response to two news articles related to accusations of fraud committed by, that is crime, being committed by big business or insurance companies. And I want to talk about these two, and they impact, well, one impacts seniors, the other one not directly, but it can impact seniors. And I want to talk about those two types of topics. My tip of the day is I want to encourage seniors to educate yourself on corporate and insurance company crimes, what that looks like, and how that impacts you in a detrimental way as a senior. This is very important. Earlier this year, I put together two Dish on Aging videos in response to the question, what can I do if I cannot find an in-network psychology provider? And this is true. There's two different ways to handle it if you're a Medicare patient and then if you're younger. I was finding earlier in the year, so many Americans are understandably experiencing symptoms of anxiety and depression and feeling overwhelmed because of how our daily living and lives are impacted by the pandemic, that there has been a dramatic increase in need for mental health services. And I was receiving not just calls to my office from seniors wanting appointments, but also seniors I was providing care to. They were saying, gee, I've got one of my kids, a younger family member, a grandchild, really is struggling and we're having trouble finding a provider. And the question I get is, do you know anyone? And I usually don't know anyone I can refer to. Many of the psychologists that I work with are geriatric only accepting Medicare insurance, or many psychologists that I know don't accept any insurance at all. Whereas most Americans pay money, big money, important money for health insurance, and when they need a mental health provider and they have mental health coverage, in my mind, it only makes sense that they go to an insurance company provider. So today's topic is, drum roll, how to recognize when big business, and in this case specifically, news story about an insurance company here in Pennsylvania. A lawsuit was filed because it was printed. This article was printed in, let me pull up the news article here. I thought I just had it. Okay, Modern Healthcare. Modern Healthcare is an online magazine that is talks about, it's kind of for administrators and healthcare providers who work in healthcare. And this publication gives very current news information about what's happening in the healthcare industry. And so Modern Healthcare put out their alert. They send out email alerts about what are the headlines across the country. So today's Thursday. On Tuesday of this week, Tuesday, September 14th, 2021, the headline read, Aetna lied about provider network to win Medicaid contracts in several states, including the state of Pennsylvania. And this is a lawsuit, and Aetna didn't respond. They put right in this news article that they didn't respond to requests for their comment. But, and I think I also saw a national news story about this, and specific to what's happening in Pennsylvania. I want to tell you what happened here, because this is a type of healthcare fraud, and this is what I talked about when, in response to the question, how do I find a psychology provider when I need one? And I gave 2 or 3 different suggestions. I don't want to get into that now because I actually have 2 videos in my Dish on Aging video library about that. And you can go to the library and look those up. One of them was called How Do I Find a Psychologist? It was one of the first 10 videos I put together this year. And then more recently, I think it was in April, May, or June, I published an article on what can I do if my granddaughter or grandfather needs a psychologist. And what I talked about is that when it gets down to the end of it, if you have insurance and you cannot find a psychology provider, especially if you have an HMO, what I advise people to do is to seek assistance from an elected official, if an official who has an office down in Washington, D.C. That's important for Medicare. So that's going to be a state representative or one of the 2 state senators. And the reason why, as a last resort, I encourage people to reach out to an elected official who has an office down in D.C. to help if you're a Medicare patient and you cannot find a provider to schedule an appointment with you, is so that all of the elected officials have constituent services, and you need somebody who has a knowledge of healthcare and healthcare law, who can be an advocate for you to find out if in fact the insurance company, you're paying premiums and the insurance company doesn't have a provider for you. That is a type of fraud. And that is what Aetna has been accused of doing this week, related to pediatrics, not related to mental health, not related to geriatrics. The specific lawsuit has to do with Aetna in the state of Pennsylvania, other states as well, related to pediatrics. So when you're looking for a psychology provider and you can't find one, it's like it gets to the point where you need a law degree to be able to solve the problem. And that's why I send people to the elected officials to help. Also, not only do you need a law degree to recognize and solve the problem, but once you have a law degree and you understand, get a clear picture of the problem, then you go to the insurance commission and or file the complaint with Medicare. And then what the basis of the complaint is what's called a phantom panel. Think phantom like ghost, something that's not really there. What Aetna is accused of doing, it was between 2010, well, essentially they're accused of lying to the state of Pennsylvania to get a Medicaid contract to cover pediatric care in the state. Now, insurance companies actually bid. The state in Harrisburg, they want to get the best coverage for the Medicaid children, and they want to make sure it's comprehensive. And the state knows how many children are on Medicaid. So they can calculate out and figure out how many pediatricians, how many doctors who can schedule appointments with these children do you need in the state to be able to provide the necessary care to these children. So when Harrisburg is deciding who are they going to award the contract to, who are they going to give that business to, they look at how many providers are on the in-network panel. What Aetna is accused of doing is lying. And if you lie about how many providers you have, you make more money. Oh, well, first of all, it's a crime to lie. It's also a phantom panel, and it's also healthcare fraud, insurance fraud being committed by the insurance company. The reason why they make more money is because if you need, let me just use hypothetically, if you need 100 providers to provide the care to however many patients there are, and really you only have 70 providers, that means people aren't going to be able to find providers when they need one. You've already gotten paid a lump sum at the beginning of the year, maybe the beginning, middle, end of the year. You're getting paid a lump sum to provide care to these people. So if you can kind of, stack the deck, if you will, lie, commit a crime, commit fraud, and say that you have 100 providers when really you only have 70, that means there's going to be 30% of the patients that you have sold insurance plans to who are not going to be able to find providers. There's the insurance company only gets submitted a bill if the patient can schedule an appointment with a provider. So phantom panels are about making it look like you have 100 providers who can schedule appointments with patients when really you don't. And this is one of the things that I have observed. This is not specific to the pandemic in mental health. This has always been a problem in mental health. And that is when you find yourself calling 3 or 4 or 10 or 20 or 30 providers that are on the provider panel of your insurance company and none of them can schedule an appointment with you. That's a red flag that this might be. I don't want to accuse anybody of anything they didn't do, but that is a red flag. That could be you could be dealing with a phantom panel, and that is a crime. So that's why, as a last resort, I send people to elected officials to help you sort through it. By the way, there was also a research study that was published in this same Modern Healthcare magazine that talked about how for many of you seniors, this is not going to be a surprise. The research study found that if it's too complex to find a provider, most people will get frustrated and stop looking. And so they either delay needed care or they just don't go get the care at all. And the article talked about, in some cases, you need a PhD in nursing to be able to find that specialist who can schedule an appointment with you. So today's tip of the day is to educate yourself as best you can, and you're going to be able to do that this week, over the next few weeks and next few months. Educate yourself about when you see a news story, whether it's online or you're watching TV or listening to the radio. Try to follow it if you can. What's happening in Pennsylvania, Aetna specifically was named this week as being sued for creating a phantom panel, which means they lied. And there's to the state about how many providers they had specifically for pediatrics. And there's a question if Harrisburg would have awarded Aetna the contract if they had been honest. How we lose out as citizens, in this case of the lawsuit, it's specifically children. But what happens is if you have a Medicare Advantage HMO or PPO plan and you cannot find a provider and you need a provider, that insurance company makes more money because you've already paid your premium and you cannot go get the service that you are guaranteed or your insurance covers. So this is the concept of provider or phantom provider panels, and it's harmful for patients because at the same time that patients can't get access to care they need, the insurance companies make more money if they can rig the system to make it so there aren't enough providers to go around. With that being said, we are having problems with provider shortages, but separate from that, there's also in mental health, there's a lot of providers who won't do business with insurance companies, so that complicates. There may be providers available in the community and they're not accepting your insurance, and that's a whole different problem. But I want to alert you all, as my viewers, just to follow that Aetna story and Aetna being sued, so that if in the future you find yourself not able to find a provider who can schedule an appointment with you, go back and look at my videos about how to find a psychologist. I walk you through the steps on what to do, and then as a last resort, to reach out to an elected official so that constituent services in those offices of the elected officials can take a closer look to see if more formal action needs to be taken against the insurance company. And there's a lot of things you can do. You don't have to just start by turning around and suing them. The easiest thing to do is to file a complaint with the insurance commission. Again, most of us don't know how to do that. I did that once. No, I didn't. They wouldn't. Anyway, I don't want to get into that. As a provider, you really can't. I went on, let me put it this way. I went on the Commonwealth of Pennsylvania website a few years ago on how to file a complaint with the Insurance Commission against an insurance company. As a provider, I was filing the complaint. They don't let you. You have to be a patient. So you have to be the patient. You have to put in your insurance number so they can track you. You have to identify who you are. You state what your problem is. You send it off to the Insurance Commission, and then they compare your problem with the insurance laws. And they will, if the insurance company is falling short on something they're required to do, then the insurance commission for free will intervene on your behalf and get the situation corrected with the insurance company. As a provider, I became aware there was an insurance company that needed review from the insurance commission. I just sent the insurance commission an email and explained to them what the situation was. And they did follow up, and they did get the problem corrected from me as a provider. So back to the research study about we shouldn't have to need a PhD in nursing to be able to find healthcare providers that we need. And that is absolutely true. And it's unfortunately at times, not always, but at times this will come up as a problem. And so I wanted to, so again, my tip of the day as seniors, just follow this. Try to educate yourself about healthcare fraud or fraud being committed when insurance companies are accused of committing a type of fraud. What does that look like, and what can you do as a Medicare patient if you believe that your insurance company is committing fraud, specifically when it has to do with the fact you cannot find a provider? Okay, so I know I went around in circles on that a little bit, but that is in summary the tip of the day. So be well, everyone, and I will see you on Monday. And Monday will be September 20th. Okay, have a nice weekend. Bye-bye.